Coronavirus, severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, better known as coronavirus, is a new type of coronavirus that is transmitted to humans. The virus can affect anyone, such as the elderly, adults, children, and infants, including pregnant women and nursing mothers. Coronavirus infection is called COVID-19 coronavirus disease 2019 and was first discovered in Wuhan City, China in late December 2019. The virus is transmitted very quickly and has spread to almost all countries, including Indonesia, in just a few months. This led some countries to implement policies to enforce lockdown in order to prevent the spread of coronavirus. In Indonesia itself, a large-scale social restriction policy (PSBB) was implemented to suppress the spread of the virus. Coronavirus is a collection of viruses that can infect the respiratory system. In many cases, the virus causes only mild respiratory infections, such as flu. However, the virus can also cause severe respiratory infections, such as pneumonia. The virus is transmitted through droplets of the respiratory tract. For example, when in a crowded enclosed space with poor air circulation or direct contact with droplets. In addition to SARS-CoV-2 virus or coronavirus, viruses that are also included in this group are the virus that causes severe acute respiratory syndrome, SARS, and the virus that causes Middle East respiratory syndrome, MERS, although caused by a virus from the same group, namely coronavirus. COVID-19 has some differences with SARS and MERS, among others in terms of the speed of spread and severity of symptoms. Death rate due to coronavirus COVID-19. Coronavirus that causes COVID-19 can attack anyone. According to data released by the Task Force on the Acceleration of COVID-19 Handling of the Republic Indonesia, the number of positive confirmed cases until March 25, 2021 was 1.4 million people, with the number of deaths of 39,983 people. The case fatality rate due to COVID-19 is about 2.7%. When viewed from the percentage of death divided by age group, then the age group 46 until 59 years have a higher percentage of mortality than the other age groups, while by gender, 57.1% of people who died from COVID-19 were men, and the remaining 42.9% were women. Coronavirus symptoms COVID-19. Early symptoms of coronavirus or COVID-19 infection can resemble flu symptoms, namely fever, runny nose, dry cough, sore throat, and headache. After that, the symptoms can disappear and heal or even get stronger. Patients with severe symptoms can experience high fever, plain cough, and even bleed, shortness of breath, and chest pain. These symptoms appear when the body reacts against the coronavirus. In general, there are three common symptoms that can indicate a person is infected with coronavirus, namely fever, body temperature above 38 degrees Celsius, dry cough, shortness of breath. There are several other symptoms that can also appear in coronavirus infection, although less often, namely diarrhea, headache, conjunctivitis, loss of tasting ability, loss of ability to smell, anosmia, rash on the skin. The symptoms of COVID-19 generally appear within 2 days to 2 weeks after the patient is exposed to coronavirus. Some patients infected with coronavirus may experience oxygen loss without any symptoms. This condition is called happy hypoxia.